Hello, welcome to the hand irrigation instructional video. We hope you find this helpful today. My name is Hannah and this is Catherine.
Hi.
And we will be walking through this demonstration. So we're first going to talk about just the different catheters that you might see in a patient. This is a typical catheter. It's got 2 ports on it. This one would be connected to the Foley drainage bag, and this one is used for inflating the balloon with 10 cc's of saline.
And this is a Foley you may see on your unit. It's used for continuous bladder irrigation, also known as a Creevy. It's a 3-way catheter, and the 3 comes from, the first is the balloon. The second is the output of the catheter into the bag. And then the third is the input of the irrigation continuously going into the patient's bladder. A little bit about the Foley. Most of us are already familiar with this, but there are numbers listed on it. One is the size of the catheter, and then the other is how many mils that should be inflated with saline to keep the catheter intact in the bladder. We just wanted to demonstrate to you how much bigger sometimes these Creevies are in urology patients or when it's inserted. So this one has 30 cc's. Well, this is.
You can see it's starting to inflate. There's 10 cc's. There's 20. And that is what 30 cc's of normal saline will look like inside of the patient, keeping this in place. So sometimes with the continuous bladder irrigation or just these larger Foley catheters, there are some indications to hand irrigate, and sometimes this might get in the way of doing the hand irrigation. Some of the reasons that you might hand irrigate include if it's leaking around the catheter, if the patient is uncomfortable, if there's like bleeding or clots in the Foley, if they're having diminished output, and if that's the case, you might want to bladder scan them before just jumping right to hand irrigation. So now we are going to do a little demonstration and what kind of supplies you would need for the hand irrigation. So first, we'll start off with the hand hygiene. Clean gloves. And when hand irrigating, it's usually helpful to have a second person if they are available. You're gonna first start out by grabbing this kit. It is called the irrigation tray with a piston syringe. If this kit isn't available, we do have a backup, which you can use the graduated cylinder and the 60 ml syringe. Each time that you hand irrigate, get a new kit. When you're finished, discard all of the materials.
Also, if there are orders to hand irrigate for urology patients, you will need them. It will delineate whether or not you need normal saline or sterile water. Per protocol, you can use either or, but just double check those orders. You will need some packaged irrigation solution.
open up the kit here. And it comes in a syringe like this. And there's a little cap on it, so we can discard that. And there is a little blue cap here that comes in the kit. We also will not use that. We're going to pour this normal saline into this conduit. It comes with an alcohol pad and a label, but we're not going to label anything. We're going to use it and throw it away. It does come with this blue.
It is waterproof. If you put it mat side up against the patient, it will help prevent them from spillage. But we also recommend using some towels or chucks, just in case.
So, like Catherine had mentioned, or maybe she didn't yet, but we are, where the catheter is connected to the bag is where we're going to hand irrigate. This would be connected to the continuous irrigation, which we would stop for the time being.
I'm just gonna pull the pole over. You will never disconnect this portion. This will always stay the way it is once it's there. I'm gonna bring this down for us. Okay. This is our irrigation for a CBI, continuous bladder irrigation. You'll see two bags attached to the IV pole. We'll talk a little bit about maintaining the bags once we're done with our hand irrigation video, but the biggest thing is while you're hand irrigating for the patient, you want to make sure that this is clamped all the way down so that you're able to see what irrigation you're putting through manually.
All right, now for the demonstration of the hand irrigation. Typically easiest to do this while standing. We are going to stand but demonstrate as close as we can. So, like we said, it's best to have two people available if possible.
I'm curious if we can angle it.
We're gonna,
there we go.
is that good?
Yeah.
So we're gonna disconnect the Foley bag and try and keep a pinch on the Foley itself.
Have the second person hold this. If you don't have a second hand, you can use this cap. This is sterile. You can use it a couple of different ways. Say you needed your hand free not to clamp, you can stick this in here, but also you can use the cap on the other top of this and put it to the side.
You want to do this?
Sure. So when hand irrigating, you want to make sure there's enough fluid that you're pressing, that you're using for the tube to allow for any clots to be loose. So per urology team, they recommend putting at least 120 cc's into the Foley first before trying to expel any clots. And remember, this is after you have verified that the bladder is not already full.
You can do this pretty forcefully. Don't be afraid. It might be painful for the patient, but we have determined that there is an indication to irrigate the bladder, and so we need to stir up the clots to be able to get them out.
Here's 120 cc's. And the piston syringe comes with finger grips. Feel free to use these if you need to exert a little more effort. So we've put 120 cc's in. We're going to expel if you might feel some resistance if there is a clot, in fact, obstructing the edge of the catheter. If that's the case, you can always add a little bit more saline, but actually irrigating and aspirating until you see some clots expelled is indicated in this matter. Say you have a syringe full of clots. What you want to do now is, it's waterproof. Use your tray here without touching the tip of the syringe to remove any clots that you may have expelled. You can add more sterile water to your tray here, and then just continue this process until returns have become more clear. Once you're done irrigating, hopefully the patient will be feeling a bit more relieved. You can reattach the bag to the catheter.
And what we're looking for is like a pink grapefruit colored urine, and start the bladder irrigation back up so that it keeps flushing the bladder out to prevent those clots from forming again. One other trick, if you're getting resistance when trying to hand irrigate, you can deflate the 30 cc balloon and have someone be sure to keep the catheter in place so it doesn't come out of the patient while hand irrigating it. But sometimes that allows you to get the clots out a little bit easier as well. We hope you found this video helpful. Please let us know if you have any questions from the unit-based council members or East 31 staff and urology. Thank you.